Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level.
Good morning and welcome to the Veterinary Rehabilitation Podcast. Today we are revisiting an interview with Annalie Sanders. She is one of our Vet Rehab Summit lecturers, and if you did not get to attend the event, it was phenomenal. You can still watch her recordings at the Vet Rehab Summit website if you purchased a ticket or you're an Online Pet Health member until the 8th of February. So I highly encourage you to do that. Today, she shares 3 foolproof tips for improving your therapeutic exercise results. And I think you're going to love what she has to say. Before we head into the interview, I want to say thank you to our sponsors for the podcast, Paw Prosper. At Paw Prosper, they believe that true pet well-being demands a 3-pronged approach: prevention, support, and rehabilitation. Their brands are trusted by veterinarians, universities, and rehabilitation facilities. So whether you are looking to train, rehabilitate, or help your patients age gracefully, brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, FitPaws, Muffins, Halo, Sleepy Pod, and Canine Carts all offer effective, innovative, and proven solutions. Sign up today to receive a special gift for all our Online Pet Health listeners with your next order. You can sign up using the link pawprosper.com/OPH. Over to our interview with Annalie. I hope you love it as much as I do.
Hi guys, and welcome. Hi Annalie, thank you so much for joining me.
I'm so excited to be here.
It's so good to have you back again. It has been far too long since we've had Annalie online.
Me
All right,
too.
today we're going to talk about how you guys can make your exercise, your therapeutic exercise, how you can make your therapeutic exercises more effective, a few tips and tricks along those lines. But before we get started, let's get to know Annalie a little bit better. I am not going to ask you to introduce yourself. Instead, I'm going to ask you some fun questions.
All right.
So are you ready for me?
Yeah.
All right. If you could swap lives with one animal for a day, which would you choose?
All right. Well, I would have to say I'm working with a dog right now. Her name is Bee, and she has had intermittent 3-legged lameness going on now for 2 years, has had 3 MRIs, and is still not diagnosed. So I would like to be Bee so that I could ask her, what is going on with you, right? Where is the pain coming from? You know, what are you feeling? Because right now everybody is saying she's fine, and she's not. So I would want to be Bee.
I've asked that question to everyone I've interviewed, and you and one other person, both of you lecturers, have answered me with a patient. Mm-hmm. And I think that's really, it shows the depth of love and empathy that you have for the animals that you work with. Mm-hmm. Because if you could spend your whimsical free time being anything, you'd want to be them.
I want to be them, right? Like, why are you holding your leg up?
Let's get back into the questions.
Okay, questions.
What's one thing that most people would be surprised to learn about you?
Well, let's see. So I would say one thing that is surprising about me is I am actually a high level pickleball competitor. If you don't know what pickleball is like tennis, but with a wiffle ball. So it's an up and coming sport that is starting to cross the globe worldwide. So yes, that's what I do in my limited free time.
Okay, so I'm going to shoot some quick fire questions at you, and you're going to just tell me which one is your preference. There doesn't have to be a reason. It could just be either or. Okay. Do you prefer puppies or seniors?
Seniors. Yeah.
A walk in the forest or a structured workout?
Ooh, walk in the forest for me, structured workout for my dogs.
Sunrise or sunset?
Ooh, I would have to say sunset.
Strengthening or stretching exercises?
Ooh, I would say eccentric contraction, because then you get both.
Reading or podcasts?
Ooh, I have to say with the dyslexia, definitely always in my ears. Yes, for sure.
I like it. Okay, so podcasts or audiobooks?
Audiobooks. Long series if possible. Then I don't have to make any decisions about what comes next.
I agree. I like that. That's a good one. Do you prefer teaching or learning?
I think they're the same. I learn so much when I teach. So I have to say that they're the same. Yes.
Okay. I like that. All right. On a scale of 1 to 10, how important do you think this year's theme, Dynamic by Design, is for our profession, and why?
Well, I think it's up there. I would say 8 to 10. You know, that when we are thinking about designing an exercise protocol or designing a movement pattern that we're putting the dog through, there does need to be real intentionality, right? So it has to be intentional what we're doing. And those movement patterns really should start simple. And this is kind of what I want to get into today. Should start simple and build to fully dynamic if the goal is to get the dog back to full functionality. And this is especially true for high drive dogs or sport dogs or dogs really wanting to participate in the world with their body. That there has to be intentionality in design. It has to start simple, but then we have to increase in a stepwise approach from rehab to conditioning in order to get that dog back to full functionality. So I would say this is, so far of all of the rehab summits you've done, my favorite topic.
Yes. Well, okay. I would love to say it's my favorite topic, but I legit say that every single year, and every single year it's true. So, you know, it is true this year once again.
Until next year.
I don't know what to do. Okay. It's true. It is my favorite topic. Okay. All right. Annalie, what is the most common mistake that practitioners make when it comes to therapeutic exercises? So practitioners, like professionals, veterinary rehabilitation therapists.
I think it's making two things too complex, right? And this is kind of what I want to talk about today also. So this is a good, discussion point is, if our goal is to teach the learner, which we have two learners, we have the dog learner and the human learner, right? If our goal is to teach the learners what we want them to do, cognitive load theory says that there's only so much space in my brain at one time. So if I'm trying to learn something new, that new skill has to be really simple. It has to be clearly defined, and I have to be able to reproduce it regularly for me to get that positive reinforcement, right? And so I think really paring things back and starting simple is the main foundational component in making therapeutic exercise from the rehab perspective and the conditioning perspective, from the dog training perspective, effective.
I think there is much more there as well, because if we say simple, like what does that even mean? Because I could think that simple is a sit to stand exercise, right? but is that simple?
Right.
Or
It could be as long as the criteria is well defined. Sit to stand, fine, but how are we making the variables included within that exercise simple, right? Does the dog know how to sit squarely first? Because if not, the sit to stand exercise is not simple.
Mm. Mm. Okay, I like it. So
Yeah.
really looking at the biomechanics of that exercise and then breaking it down, and the handler comes in there as well. I love that you have those two learners. That's so important.
Yes.
Okay,
Yes.
so how does form-based training transform our rehab outcomes?
Okay, great. And so this kind of goes back to my comment about B, you know, because we're dealing with one learner that is nonverbal, right? Our dogs and cats and horses, right? They can't talk to us with language. So we have to take things back to a simple enough starting point that we can ensure the dog understands what we want from them. And then we can ensure that we're using correct muscle recruitment. So, for example, in our sit to stand example exercise, if we're seeing bilateral external rotation of the rear limbs, we are unintentionally recruiting the lateral quadricep, the lateral hamstring, the external hip rotators, the gluteals more than their counterpart, right? And so form drives functionality as well. So by using things like an elevated platform that's narrow enough to require those rear limbs to come into neutral alignment, we are also then ensuring correct muscle recruitment, or even muscle recruitment, the muscle recruitment that we're intending. If the dog can't sit in a static position squarely, and then we're asking them to transition to a stand, they're not likely going to be able to, and they're surely not going to be recruiting the musculature that we want them to be, right? So in order to affect proper muscle recruitment and have good results in our therapeutic exercises, we have to ensure proper alignment, first static, then dynamic, stable, then unstable, isolated first before integrated.
Yeah, I like that. And that's so relevant for us as rehabilitation therapists, because so often if there's an injury, there is going to be a change in form, there's going to be a change in muscle recruitment, and we need to know how to correct that, as you said, progressively from a safe place and then building up. So I really like that. Hi, everyone.
I'm
We have
so
so many
happy
people live with us.
to see all these names that I know. Thank you, everybody, for hopping on this morning.
It's so good to have everyone. Thank you. Okay, can you share a little example with us of when a small adjustment to form made a huge difference to the exercise? Because, yeah, again, I think there's just more that we can dive into in that space.
Yes. So, I'll be talking about this a little bit more in the Vet Rehab Summit as well. So I don't want to give too much away, but, I think that teaching the handler a few skills to help their dogs adjust form gives a lot of positive reinforcement to the handler, because the handler then can see that the dog is executing correctly with more frequency. And then I start to get an intrinsic reward from all this time and effort spent, doing my conditioning exercises with my dog. So one example that I will also go into in the Vet Rehab Summit is teaching the posture sit exercise. So in the sit position, if the dog is kyphotic, sitting with a rounded posture, sitting with their pelvis rotated backward with a lot of flexion in the spine, that's going to change, how the shoulder muscles are being recruited, how the pelvic muscles are being recruited. And one of the easiest adjustments that we can teach the handler is to raise placement of reward, right? So when we raise placement of reward and get the dog to take the reward from a higher position, we also inadvertently trigger the epaxial muscles, the back muscles, the hypaxial muscles, including the iliopsoas, to engage and rotate the pelvis forward, bring the spine into better alignment, which also then makes the limbs load bear more correctly. So that simple adjustment of just raising placement of reward, and then this is the kicker, marking that, using dog training to teach the dog, yes, that behavior of recruiting your back muscles and rotating your pelvis forward is earning you this cookie, right? Then we build value to that adjustment so the dog is more likely to offer it the next time as the means to earn a reward, right? So we help the handler be more successful. We teach the dog, hey dog, you get a cookie if you do this thing, right? Both learners are having a better time, and we're starting to recruit more precisely.
Yeah.
And then we get, as a side effect, better outcomes from our therapeutic exercise. Because if a dog is doing a sit to stand from that poor posture, we're not actually targeting the muscles that we want to target anyways.
I am so glad that we are having you speak about the biomechanics of the movement of the therapeutic exercises plus the handler skill, because I wouldn't even have thought of that intrinsic reward that the handler will get when you empower them with the knowledge and the understanding to see, to actually identify. I could just feel that weight of like uncertainty and confusion lifting off of me as you said that. I was like, yes, that's what it feels like. You don't know what's going wrong, so you don't know what to do, and then you just, it's very demotivating. And the moment you change that pattern around, it is so motivating and so much fun for the human. And the dog is already having so much fun, so it just amplifies it for them so much. So yes, you have the right topics for the summit. I love it.
I'm so excited. I'm so excited.
Awesome. Okay, so what are the you when we discussed this live, you spoke about 3 tips, right? That you have for us to improve our efficacy. So do you want to share your 3 tips with us?
Yes. And so the overarching theme of these 3 tips is really to simplify, to make everything not necessarily easier, although yes, maybe, but simpler, so that the handler and dog can focus more on this distilled down goal of each exercise, right? So my first tip, and I just want to preface this by saying, I, as a practitioner, also struggle with this because I want to give my clients everything. I want to give you everything. I want it to be very obvious that I care about you, and I'm, not trying to make money off of you. And I really want to pour into every dog handler team. So this is a challenge for me also. But the 3 things I have found make dog handler teams successful and want to come back and continue to do their exercises and make them able to commit is to simplify, 1, the exercises themselves, right? That when an exercise is, and we're talking about in the beginning, right? Because of course we are progressing to fully dynamic exercises, but that comes later. In the beginning, simplifying the exercises so that the movement pattern is simple, easy for the dog and handler to execute correctly, so that we're staying about at that 85% accuracy rate. So within a set of 10 repetitions, 8.5 are good, 1.5 are throwaway. That's fine. That's kind of what I want. So to simplify the exercise, right? I recently did a big blog post about helping to rebalance the musculature in the foot for dogs with flat feet and rolling off the toe pads and splayed feet. And I recently put up some videos about teaching the contraction of the digital flexors. Because if we start with global movements like cavalettis or walking upstairs or even standing on a peanut, we're not really reteaching that contraction of the digital flexors. So instead of going global, trying to go local and really target those muscles so that the dog says, hey, when I do this thing with my foot, which feels weird, I get a cookie. Cool. I'm going to do that again, right? So to really simplify the exercises in the beginning, one. Questions about that?
Questions about that? No, I think that's so cool. I love the foot exercises that you've given already that I've been seeing, because I'm like, in the past, what did we teach them, to dig or to scratch?
Right. Right.
Yeah.
Which could trigger those muscles, but can we guarantee that? No.
Yeah.
Right.
No.
Not always. Right. So one, simplify the exercise. Two, we have to start incorporating dog training into our exercises, right? That means teaching the handler, all right, Anne, this is what I want you to do. We're going to ask your dog to come onto this platform. When they sit squarely and try and tuck their legs in, we're going to use your marker word, I use yes, and reward the dog, right? When you see them readjust their limbs again, mark yes, and reward the dog, right? We're going to do that 5 or 6 times, then we'll release the dog from the platform and start again, right? So that the handler understands their responsibility in the equation is to teach the dog the movement pattern we want. And that movement pattern might be, again, very basic, like squaring up the rear legs on the platform. It could be engaging those foot muscles, but later it turns into the ability to link these basic components together into more complex exercises. So when I'm teaching a hop back stand, the dog knows, keep my front feet still, load forward into the shoulder, elevate the rear end, unfurl the spine, land with the back feet in neutral alignment, that they have learned all those different components and can put them together. So incorporating dog training into our therapeutic exercises so that the handler and dog actually learn the movements that we want them to.
Okay, so actually we need to be trainers. We need to understand how training works, what are our 4 quadrants and how to use them, and all the other things that go with that. I think that, okay, awesome.
Yeah. Yes. And, it's important to also mention the rehab environment is tricky, right? It's tricky for a lot of dogs. Sometimes rehab modalities are uncomfortable, for the dog, and they don't love being there, or the environment is stressful, and, the dog is not able to learn in the moment. That's okay, right? That's why we give homework exercises, so that the handler, the other learner, can take the dog into a controlled environment and work on these things at home, right? So it's okay if the dog can't do the thing in clinic. If the protocol is simple enough, they'll be able to do it at home.
Okay, I like that. Cool. So we do have some questions, but I think you should tell us number 3 before
Number 3.
Yeah.
Less exercises. Being on the client side, rehabbing my own dog when Hot Rod ruptured her CCL, I'm already working full time. I'm stressed out because my dog is hurt. I've spent a bunch of money because, of course, she needed to have surgery. And my homework exercises, including walking her 6 times a day for 5 minutes, which that was stressful. I had 12 to 15 exercises that I was supposed to implement. That was too many, right? I couldn't get them done well I couldn't get them all done. I was rotating through them kind of willy-nilly. I was not positive reinforcement. I was positive punishment. I didn't want to do them because I felt so overwhelmed with it. In my exercise protocols, I usually give 5 max, 4 exercises, because that is reasonable. Then if the handler is like, I'm doing so great with these, give me more, I can, right? But if 4 is too much, right, I have to then pare back. 15 is going to be way too much, and they may not come back. And this kind of speaks to the few posts that Online Pet Health put out recently, like, hey, you do 6 TikToks with your dog this week, but you can't do your exercises. Well, that's a mistake from me, the practitioner. I gave you something that is not easy for you to complete, because you should be making your TikToks out of your rehab exercises.
Yes. No. Kate is saying that, 3 to 5 simple exercises is what she's been given.
Yep.
And that is more normal. That is the general rule of thumb, is that we, like, as professionals, you don't want to give more than 3 exercises per week, because it's too much. It's too overwhelming.
Good.
So that is odd. That is not the norm, that you got like so many. That's very overwhelming.
Yeah, it is overwhelming. And I see that from the practitioner side. I see people come to me saying, like, here's my rehab protocol, but it's too much. Right. And so I think there might be like a bit of a discrepancy, depending on the school you come from, of how many, or it could just be the practitioner trying to give you everything, like, from a good place, from a caring place.
Yes. Okay. I think there could also be a scenario where you're coming from post-surgery, and the veterinarian gives you a 6-week protocol in one go. There you go. Goodbye. That is very overwhelming to not be given it on a weekly, little by little basis. That's a lot.
Yeah. Less is more. Simplify.
Okay. I love that. So, be specific, and the training, become a trainer. Make sure that you have your training down really pat. That's up to you, because you can't teach it if you don't know it. And then less is more.
Less is more. There you go.
More. I love that. Thank you so much. That is amazing. Awesome, guys. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paul Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out, paulprosper.com. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of October, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com. And if you want access to our free membership, we update the webinars in this area every 3 months. You can sign up at onlinepethealth.com/free.